Post-operative instructions, orthognathic surgery. Go to your nearest emergency room if you are having trouble breathing. Notify our office if you have increasing drainage from your incision or recurring fever greater than 101.5 Fahrenheit for more than 12 hours. Facial swelling will increase for the first 48 to 72 hours. Apply ice packs, 20 minutes on, 20 minutes off, and keep your head elevated with an extra pillow or by sitting in a recliner. Most of the swelling will resolve within the first few weeks. However, healing will continue for 4 to 6 months. Bruising may occur after a few days. In some cases, the bruising may extend onto your upper chest. You may shower, but try to keep the bandages dry. A small Band-Aid may be applied if they come off. Avoid smoking and alcoholic beverages. Brush teeth gently with a child-sized soft bristle brush. You may use toothpaste. Your gums will have reduced sensation. Be careful not to injure the gums while brushing. You may use a mouth rinse. If the teeth are rubber banded together, please try to limit your jaw motion. The rubber bands may be cut with scissors in case of a true breathing emergency. Notify the doctor afterwards. If you are given an antibiotic, it should be taken as directed for 5 days. The first dose may be taken when you arrive home. The liquid pain medication can be taken every 4 to 6 hours as needed. While the teeth are rubber banded, meals may include liquids such as juice, broth, milk products, including soy and rice, and liquid supplements such as Instant Breakfast, Boost, and Ensure. No chewing. Your doctor will advise you when it's safe to begin chewing. Most large pharmacies carry a variety of supplements in different flavors. It is generally easier to sip directly from a cup, but you may use a straw if you like. You should try to have 4 to 6 liquid meals a day to be sure that you are receiving ample nutrition and hydration. Do not lie in bed all day. This can lead to pneumonia and blood clots. Light activity is acceptable, even good. Try to be out of bed during the daytime. You should not drive if you are taking pain medication. Please notify your doctor if you feel that your bite has shifted. Doctors Kupferman, Walline, and Relle may be reached at 310-842-4811, 24 hours a day if there are any questions or concerns. Upper jaw patients. Nasal congestion and minor nosebleeds are expected. You may sniff back or wipe the nose, but do not blow. You may use a saline nasal spray to loosen clots and mucus. Afrin nasal spray may be used for severe congestion, but no more than 2 consecutive days. Follow-up after surgery. We understand that the first week after surgery can be difficult. Although the swelling peaks at 2 to 3 days after surgery, it doesn't really start to come down until after the first week. At 2 weeks after surgery, usually 70% of the swelling has resolved. For the final swelling and numbness to resolve, it will take weeks to months after surgery. It is not unusual to be more swollen or numb on one side than the other. 1 week after surgery, you will follow up with Doctors Kupferman, Walline, and/or Relle. If you need to be seen sooner, it will not be a problem. At 1 week, the swelling should be starting to come down. You should still be on a liquid diet at this point. Your doctor will change out your rubber bands and answer any questions you may have. At 2 weeks after surgery, you will begin to take off and put on the rubber bands yourself. We will show you where we want the rubber bands to go. The doctor may change the pattern of your rubber bands over the next 8 weeks. You will take the rubber bands off for 3 reasons: eating, mouth opening exercises, and brushing teeth. Your diet can advance to very soft foods, such as mashed potatoes and very soft pastas. No chewing. You can have anything you want, but no chewing. With the rubber bands off, you will now begin to stretch the mouth open. You will need to do this 6 times a day for a period of 5 to 10 minutes. We do not want you to hurt yourself. Stretch the jaw open so you can regain your normal mouth opening. After your meals and mouth opening exercises, you should thoroughly brush and clean your teeth. If you have a splint on the upper jaw, do the best you can. We understand that this can be difficult. Splint. In rare cases, a splint is left in after surgery. If this is the case, your doctor will remove it 1 to 2 weeks after surgery. 6 weeks. You can blow your nose 6 weeks after surgery. We will again assess your bite and change the elastic pattern if needed. 8 weeks. You may begin chewing food 8 weeks after surgery. Start with softer foods, and over the next 4 weeks, you can transition to a normal diet. If you still have rubber bands, you will likely need to wear them only at nighttime now. 12 weeks. You will need to be seen 12 weeks after surgery, and then every 3 months until your braces are off. After your braces come off, you will need to come into the office for final records.